Hi, my name is Julia Ramsey. I'm the uSPEQ Accounts Manager, and I'm here to give you an overview of the uSPEQ survey product. uSPEQ is a turnkey data collection and reporting service that helps you collect data from your stakeholders on their experiences. And this can be one way to fulfill the standards of CARF Standards Section M and N. uSPEQ stands for Universal Stakeholder Participation Experiences Questionnaire. And our goal is to help organizations like yours gather feedback on the experience of stakeholders, such as persons served, employees, and family members. Get feedback on their experiences with your organization and their satisfactions with services received. We give quality a voice. Our survey tools cover multiple populations to gather feedback from anyone who you may want to get information on. This is going to include your person served primarily, including we have a separate questionnaire for folks with intellectual or developmental disabilities. We have a survey tool available for your employees, for the family members of persons served, particularly for aging services and child and youth services environments, other stakeholders such as referral sources, funders, payers, and so on and so forth. And finally, any other population you may work with on a regular basis. Our team of survey experts can help develop additional custom tools to meet your needs. The key features of uSPEQ are that it is person-centered. All of the survey items we include are from the perspective of the respondent. So, for example, I feel safe here, or my manager listens to me. The items included on the surveys are cross-cutting and applicable to a variety of settings. The consumer survey, for example, includes items on service responsiveness, informed choice, and overall satisfaction that are just as at home in an inpatient medical rehab setting as a drug detox clinic or in a day program for adults with disabilities. Benchmarking is available for the consumer and employee surveys. These provide you with comparisons of your organization's performance against all other organizations that use these uSPEQ tools. And finally, your questionnaires are fully customizable. We allow you to specify the items included on the questionnaire, pick your terminology, and use the data collection methods that work best for you, including telephone, online, or in-person paper forms. Some of the benefits of uSPEQ are that it's very easy to implement. You provide us with your customization information, and we take it from there. We'll create your questionnaires, do the data entry and scanning, and provide the reports for you to understand what your person served or other stakeholders are telling you. The report provides very useful insights across all populations. This will help you to identify areas of strength and areas for opportunity. We provide comparisons by site, program, and other categories such as demographic characteristics of respondents, and can provide any additional data analysis you may need to get useful information from your survey results. Additionally, the uSPEQ consumer and employee tools have undergone thorough statistical testing to prove that they are valid and reliable. You can trust that you will get good data from your uSPEQ surveys. Additionally, it's very helpful that uSPEQ is an independent, objective, third-party data collection and reporting service. This gives you a boon for your persons responding to the survey and that they have an assurance of confidentiality and anonymity. We'll never inform the organization who said what on the survey, and personal identifying information is not included. This also helps us to keep everything accountable and ensure that the results will come back in a way that's not going to introduce any bias. Our reporting timelines are quite timely. We're able to get your reports back to you in a matter of weeks after receiving the data for processing. The reports we generate are easy to understand. We provide the 5 areas with strongest responses, the 5 areas of opportunity, and all of our charts and graphs are quite easy to read and understand, even for those without a data analysis background. Our questionnaires are accessible to respondents with disabilities. We have multiple languages available. We have large font versions available. The online questionnaire is 508 compliant for low vision, and we encourage the use of assistants or proxies for individual respondents who may need some help in completing the survey. Additionally, we find that our pricing is much more affordable than some of our competitors, and we'll work with you to develop a pricing package and set of reports that meet your organization's needs and your budget. uSPEQ was developed back in 2006 and came out of about 10 years of extensive work on performance indicators. The development process was guided by the voices of persons served, various providers, payers, and experts in the field of stakeholder feedback. The CES, or Consumer Survey, was pilot tested in 2005. We worked with 14 pilot organizations in 10 states to collect our sample data, and then refined the tool in 2008 with additional independent sample from additional organizations, giving us the tool that we currently use and love today. Our survey questionnaire was endorsed by AHRQ from the Department of Health and Human Services in 2008, so we do have some external validation that we're doing things right. We ran a psychometric analysis on the consumer and employee surveys to prove that things are indeed valid and reliable. And that tells us that our survey has good content and face validity, excellent reliability, very good construct validity, and predictive validity. To explain what that means a little bit more, reliable means that a tool is collecting consistent data. So in our first target picture here, all of these shots are grouped together, so everything is nice and consistent. Valid results mean that they hit the target, but they may not say the same thing. So we are asking the right questions, but in this case of valid but not reliable, it's not what you're looking for. Valid and reliable asks what it means to, gets data that pertains to what it attempts to measure, and does so in an appropriate way. The Tier 1 items were additionally shown by our analysis to be cross-cutting and relevant to a wide variety of customer service units or service areas. If you're interested in the details of this psychometric analysis, we're happy to provide the uSPEQ technical report upon request. The survey instruments consist of 3 types of items. The first are the Tier 1 or required items. These are cross-cutting, are going to be applicable to pretty much everybody, and will be included on all survey questionnaires. The Tier 2 items is a larger pool of items that are field specific. You can pick and choose the ones you'd like to include from this list. For example, if your organization offers food, housing, or transportation, those items are considered Tier 2 because not every org uses them. Additionally, you can include Tier 3 or completely custom items. So if there are particular initiatives at your organization you'd like to ask about, or as of recently, we've had organizations asking questions about their response to COVID-19, these would all go in the Tier 3 or custom item section. All the Tier 1 and 2 items are on a 4-point Likert rating scale, which ranges from strongly disagree to strongly agree. The items on the consumer experience survey are grouped into the following domains. We ask about service responsiveness, which speaks to the CARF domain of access. Were you able to get help you needed when you needed it? Informed choice speaks to how much the participant was able to have input into their treatment goals and their care plan. Respect, did people here respect you as a person? Were they respectful of your culture, your gender, your age, and other things about you? Participation and outcomes, are you able to do things better now as a result of receiving services? And finally, overall value. Did you have a positive experience here? And would you recommend a friend or family member to this org for similar treatment? The domains for the employee survey are very similar and grouped into the following domains. We ask about organizational climate, which includes diversity and being aware of your organization's mission. We ask about communication, how well things are communicated within your org. The leadership, are they providing good leadership to your organization and executing the mission and vision? We ask about work group, which may be your departments, your teams, your silos. Is there good teamwork in your department? Is your manager supportive of you and your colleagues? Staff support for the organization, including work environment, staff development. Do you receive training and tools that you need? Also, compensation and recognition, pay, benefits, time off, flexible working time, other things that are crucial to the work experience. And finally, overall job satisfaction. Do you like your job? Are you planning to still be here in 2 years? And would you refer a friend to work here? The family member survey is still currently in development, but these items are grouped into the following domains. We ask about communication, autonomy, staff and care, respect and privacy, and overall satisfaction with your relative's care. We also offer program specific items that may be applicable to facilities such as nursing homes, foster care environments, or other programs, residential, child and youth services, and employment services. All surveys also include demographic items, and the goal of this is to identify if your respondent pool is truly representative of all stakeholders that you would ordinarily be surveying. So, for example, we ask race and ethnicity, gender, and education on all of our survey tools, which will allow you to see if your respondents to the survey perhaps skew younger or fewer minorities compared to your entire population to let you know if you need to take that into consideration when analyzing your survey results. On the consumer survey, we also ask for health status. How would you rate your health on a scale of poor to excellent? We ask if anyone helped you complete the survey, and if so, did they do it by reading the items? Did they fill out the bubbles for you? Did they provide translation? For the employee survey, we also ask how long you've been at this organization, if you are a full time or a part time employee, and what department you work in or what job title you hold. We find that this is particularly useful for additional comparisons by department to compare how different groupings are doing. You can also specify the particular terminology you're going to use in the survey items. So for the consumer survey, this includes what you call person served and the type of services that are received. For example, staff at Saguaro Rehab listen to issues raised by patients. That might be clients, veterans, person served, whatever other terminology you choose. For the employee survey, you can customize the terminology used to specify work group, your direct supervisors, and org leadership. So, for example, my department manager listens to me. My immediate supervisor listens to me. Whatever wording is going to make sense to the people taking the questionnaire. Additionally, organizations may create completely custom items, tier 3 items, to gather anything not covered elsewhere. And you can do this with an open ended item or a comment box or a categorical rating scale of your choice. We have multiple ways to distribute the questionnaires and get them into the hands of whoever needs to take them. Paper forms are our go to, particularly for the consumer survey, because people like to fill out the bubbles on hand, and it's much easier oftentimes to hand someone a physical form than trying to track them down for other distribution methods. So, when using paper forms, respondents fill them out and either return them to your organization with a drop box or by throwing them in the mail, or they can mail the envelope of questionnaire straight back to us at uSPEQ here in Arizona. We have a large font version of the survey available for those who need it. We also offer online surveys, which can be done on a mobile device or any desktop computer. You can distribute the link for this survey by email, by hard copy, such as on a postcard or a letter, or through a patient portal, any way that they can get a message from you. The online survey is Section 508 compliant and works with screen readers, screen magnifiers, and other adaptive technology for low vision folks. You also have the option of doing your telephone surveys if you'd like to call someone and get their responses over the phone. This may be particularly helpful for people in unstable housing or low vision who may have difficulty filling out a survey even with assistance. Basically, in this situation, we would give you questionnaires to fill out, and you would have a non direct staff member or volunteer call up your respondents and enter their responses online or on paper forms. So you read off the items one at a time and record the respondents' answers on the form. So when you get your data collected and sent in, we'll do all the scanning, we'll do all the processing, and turn around a report for you in a few weeks. The report contents are going to include the highlights of your survey. This is the strengths and areas for improvement based on the percent positive score. That is the sum of the agree and strongly agree responses. We'll provide historical comparisons to your current survey reporting period as well as previous so we can see how you improved since implementing uSPEQ. We'll provide a comparison between sites and or programs if your organization is broken up in that way. We'll report on your demographic items, again, to let you know how reflective your respondent pool is. And we'll finally give you the top box highlights. This is where we look at the percentage of strongly agree responses to find the items where you are going above and beyond and people are thrilled with your service versus the areas where maybe you're just doing okay. You're hitting the agree, but not the strongly agree and not really wowing everybody. So those are your opportunities to really go above and beyond. We'll also provide the results from your custom survey items and report those separately. Any comments you may include, which may include comments on any of the survey domains, general comments, or any custom comment fields you'd like to add, will be included in a separate PDF due to the potentially sensitive nature of these comments. So the survey highlights are going to graph the items here on the consumer survey, the ones that receive the highest percent positive ratings. Section 2 of the consumer survey and the employee survey will give you a historical comparison. So here we list all the items in the first domain and the performance of surveys completed in 2021, 2019, and 2017. Section 3 is going to give you a comparison by program or by site, and we only include the groupings that have more than 10 responses so that you're not jumping to conclusions based on an overly small n. But this will let you compare organizational units such as site BRR versus site CDI to highlight differences between various units of your organization. We'll provide demographic responses in a pie chart to show you your breakout of, for example, how long your respondents have been receiving services at your organization. Custom items will be broken down by site and by program as well. So here we have a sample item about protections against COVID-19 broken out by site. Finally, in the appendix of the report, you'll receive a mini report for each program and each site, detailing just the responses from that breakout group. The uSPEQ data services that are included with your questionnaire project are training for key staff. We'll work with your staff to make sure that they understand the customization and deployment process and get everyone trained in administration as needed. We also offer a free 2 hours of consultation with uSPEQ staff to interpret your results. And if you need any additional data nerd magic, and I say that with love because I'm a data nerd, we're happy to help you work up some additional analysis as appropriate. We will also provide your organization with the raw data with overly identifying information removed, such as race and ethnicity, just because it's very often the case that you can identify minority respondents too easily with that data included. So for example, we'll provide you with an Excel sheet listing site, program, time frame, and then responses on the 4-point scale for each survey item. We also do offer customized reporting, such as breakouts by demographic variables or program characteristics. After we provide your initial report, you can let us know if there's anything else you'd like, and we're happy to put together some additional reports for you. We can also provide benchmarking against the national data set. Normally, the benchmark is provided in a separate report, but we can do a comparison item by item of your performance against the uSPEQ benchmark. So for example, our national benchmark takes the items, and here we have a breakout of the average percent strongly agree here. We look at both percent positive and percentage strongly agree. Identify the 50th percentile, which is the middle of the road, the 75th percentile, which is doing well, and 90th percentile, best in class performance. So you can see how you stack up to other organizations using uSPEQ. We do graph all these out, and we are happy to provide these benchmark reports. The consumer and the employee survey benchmarks are run every other year. In 2021, we ran the employee survey, and we're happy to provide that upon request. Next year, we'll be doing a new benchmark for the consumer survey. This benchmark uses three years worth of data. Now, you may ask how uSpeak and accreditation play in. We do say that you can use uSpeak as one option to fulfill the standards in section M and N. However, it's important to note that a firewall exists between uSpeak and CARF accreditation. What that means is that CARF accreditation side is not able to see anything having to do with your uSpeak survey. Um, their data is not available to accreditation side unless you choose to share your reports with surveyors. And it does not automatically prevent you from receiving recommendations, but it is kept very separate through the survey process. Your organization may decide to incorporate the results into the survey process if you so choose, but we would like to remind you that simply collecting questionnaires is not enough. Per Section N, you do need to review the report that is provided and come up with some action plans based on your results. So, in summary, uSpeak provides survey tools with which your organization can fulfill standards in CARF sections M and N. We have a valid and reliable questionnaire. We provide data summaries with strengths and areas for improvement. And we let you view historical comparisons on your data, which is very important for quality improvement. We allow you to benchmark your comparison data to see how you're doing against other people and find opportunities to improve your services even more for the person served. Finally, additional analysis is available upon request. We encourage you to take a deep dive and slice and dice your data. And if that's something you need some help with, we are happy to provide. So if you have any questions about uSpeak, feel free to reach out either during the Transforming Outcomes conference or afterwards. My email is jramsey@uspeak.org. Feel free to email at any time with questions about uSpeak or any other survey needs you may have. Thank you very much.